In order to talk about mental illness, it might help to talk about mental health first and what that looks like. A mentally healthy person interacts with friends, has a sense of satisfaction, and is able to experience happiness. That person strives to remain optimistic and balanced, accepting, facing, and moving forward in the face of adversity. They do their best to manage emotions such as depression and anger that occur from time to time. Although they may face challenging situations with family, friends, and at work, they do their best to directly respond to and resolve problems reasonably. Mentally healthy people do not consider themselves as worthless, do not have low self-esteem, or dislike themselves. Rather, the mentally healthy person accepts themselves as they are. Mental illness occurs when the brain is not working properly and negatively impacts several areas. It negatively impacts a person's thoughts, feelings, and behaviors, and makes managing life's challenges extremely difficult. That person is unhappy, may feel unstable, and encounters many roadblocks to success. I will cover 6 areas related to mental illness. I will explain what mental illness is and provide examples of certain mental disorders. I will describe how certain mental disorders start to show up during childhood and how other mental disorders may occur during adolescence and continue into adulthood. I will suggest questions to ask yourself if you suspect that you yourself may have a mental disorder. If you do have a mental disorder, I will recommend things that you can do. I will then end with a conclusion. Since you may be wondering what mental disorders look like, I'll provide you with a few examples. Depression is an intense, prolonged negative feeling that can be unmanageable and may last for a very long time. It can be extremely persistent and hard to alleviate, despite one's best efforts to change it. Anxiety consists of fear of engaging in daily activities where one might feel a lot of stress and worry. Bipolar disorder is when you have sudden, extreme mood swings from being fine one moment to experiencing severe depression, extreme irritability, or excessive energy the next. One moment, a person may seem very positive and chatty all night, and then the next day, they may sleep all day because they feel so depressed. Sometimes they may hang out with friends, and then suddenly withdraw and isolate. Mood swings from depression to elation are common. ADHD, or Attention Deficit Hyperactivity Disorder, is when you cannot concentrate and are easily distracted. It may include hyperactivity, difficulty concentrating, difficulty sitting still, being restless, speaking impulsively, and blurting out comments that may unintentionally hurt people's feelings. Autism spectrum disorder includes a range of behaviors that go from mild to severe. Symptoms include deficits with interacting, connecting, and communicating with others. That person may withdraw from relationships and may be socially awkward. On the more severe side of the spectrum, people with autism may not be able to communicate. They may be in their own world. They may be disconnected from others. They may be socially awkward. They may have difficulty with eye contact despite someone trying to get their attention. They may have flat facial expressions that make it difficult to identify what they are feeling. They may exhibit facial expressions that conflict with what they're talking about. And they may not be interested in or relate to the conversations of others. PTSD occurs when a person experiences or witnesses a traumatic event. For example, being in or seeing a horrific automobile accident. This may cause the person with PTSD to be afraid of driving, to have repetitive thoughts, and or to have nightmares, such as when a person witnesses a friend in a terrible accident. Another example may be when a person goes through a terrible earthquake and sees someone severely injured or almost die as a result. Perhaps a person witnessed someone or a friend attempting suicide who tried unsuccessfully to prevent them from completing suicide, or who was traumatized by having attempted suicide themselves. In either case, those traumatic experiences could cause the person to be depressed as they constantly dwell on what happened. A person may have been raped or may have seen someone being raped. In this case, that person may also avoid, reject, or not trust men who could be reminders of the traumatizing experience. These are just some examples that may cause disturbing recollections on a daily basis. Some people say that mental illness is not real, and that people who claim to have mental problems are making it up. Mental illness is real. Some people experience symptoms of mental illness for a significant amount of time, and many have experienced a great deal of pain and suffering. Some people think that you can never recover from a mental illness. The good news is that, with help, these symptoms can improve with the support of caring people who take the time to understand and help each other. People without a mental illness have typical problems in their own lives that are difficult to manage. They can really struggle with something and not know how to deal with it. They can be too sensitive to something that happens. They may have trouble sleeping, eat irregularly, have problems with work or school, have family problems, have mood swings, and yet still be able to move on. People with a mental illness, however, are more significantly impacted and frustrated by these symptoms. For example, they may feel like getting out of bed is impossible. They may feel like they can't go out. They may feel like they can't do typical daily activities, and they may try to solve problems with little to no success and may actually make them worse. They may have the desire to engage in these activities, but cannot. Mental illness is caused by a combination of genetics, what was passed on to you by your parents and their parents, and what you will pass on to your children, and environment, the life situation that you grew up in. These combined contribute to mental illness. Mental illness is rarely, if ever, caused by stress alone. Mental illness is not the consequence of poor parenting or bad behavior. Mental illness is not the result of personal weakness or deficits in personality. Mental illness is not caused by poverty. Mental illness is not the manifestation of evil spirits controlling a person. Children and mental illness. Many mental illnesses tend to begin during childhood and persist into adolescence. Some of these include ADHD, autism spectrum disorder, generalized anxiety disorder, oppositional defiant disorder, where a child may be frequently stubborn and rebellious. Some mental illnesses begin during adolescence. The mental illnesses that most often begin during adolescence include major depressive disorder, which may be like a persistent sadness, schizophrenia, where one may experience auditory and/or visual hallucinations, bipolar disorder, where one may have drastic mood swings, panic disorder, where one may be stricken suddenly by fear and worry, social anxiety disorder, where one may feel uncomfortable socializing and may withdraw from others, eating disorders, where some may continuously eat while gaining weight, others may refrain from eating and lose quite a bit of weight, or others may make themselves vomit because they think they are overweight when they are not. Obsessive-compulsive disorder, also called OCD, describes people who dwell on and feel compelled to repeat certain acts, such as obsessively and frequently cleaning to make sure there are no germs. Addictions occur when others become addicted to substances or behaviors such as drugs, alcohol, gambling, etc. I'd like to ask you several questions for you to analyze a few areas of your own life. Do you often feel very angry or very worried? Do you often engage in dangerous behaviors that could harm you or others without thinking of the consequences? Do you hurt other people or carelessly hurt yourself? Do you assault people and destroy property, perhaps because you feel jealous and doing so makes you feel good? Do you excessively use alcohol or do you indulge in using various types of drugs? Do you neglect problems in your life with an I don't care attitude about the fallout? Do you worry that your mind is controlled by something or someone, or does it feel out of control? Do you go to the gym to exercise every free moment to get impressive six-pack abs or a muscular V-shape? Some people are never satisfied unless they are enormously muscular. Do you constantly diet to lose weight, or do you frequently binge eat to gain more mass? Suppose you had a family member, a friend, or a loved one who died a long time ago, whether or not they died of natural causes. After so many years, do you still feel significant grief, or do you have a difficult time letting go of that loss? Perhaps you should check to see if you experience any of these potential indicators of having a mental illness. Perhaps you recognize that you may have symptoms of a mental illness. Maybe you notice that you struggle with frequent sadness, significant stress, the tendency to worry, frequent irritability, wanting to cut yourself, or temptations to kill someone, to name a few. Don't worry. The person who experiences a mental illness can be treated and can experience a vast improvement. How can you get better? It might be helpful to find a family member or a friend with whom you can share your feelings. You may end up feeling much better. Perhaps you could call a therapist who will skillfully listen to you and who will provide you with support where you can brainstorm ideas on how to solve problems. After listening to you, your therapist may suggest that you go to a doctor for a physical exam, or suggest that you see a psychiatrist who may make a recommendation for medication if it is appropriate. In summary, there are many people with mental disorders who lead stable, successful, and productive lives while asking for help, talking about their difficulties, and possibly taking medication for their mental illness. Some people have severe and persistent mental disorders which, even with medication, take much longer to improve. If friends, family members, or you yourself have a mental illness and need help or support, go see a counselor or chat with a friend. Okay? Remember, you are not alone. Anyone can be affected by mental illness. It does not matter how much money you earn, your education level, cultural background, or religious beliefs do not matter. Anyone can be affected by mental illness. In fact, many people that you run across on a daily basis may look normal, but some of them actually have a mental illness. Don't worry, you're not alone.